Hi, I'm Michelle Walker, AOPA Media, and today I'm going to go over the recently released 169-page report brought to the FAA concerning pilot mental health.
AOPA keeps flying safe, accessible, and fun by protecting your freedom to fly. We are the most trusted one-stop resource for all things related to general aviation. Become an AOPA pilot today.
This report was brought by the Mental Health and Aviation Medical Clearances Aviation Rulemaking Committee to provide suggestions for breaking down the barriers preventing pilots and air traffic controllers from disclosing and seeking care for mental health issues. The committee is made up of psychiatric and psychological medical experts from the FAA, the NTSB, academia, various aviation industry stakeholders, trade associations and organizations, civil aviation authorities, and more. AOPA Senior Vice President of Government Affairs and Advocacy, Jim Kuhn, is representing AOPA on the committee.
The process was very collaborative, and there were a lot of experts in the mental health area that helped guide us along the way. And not only those individuals, but those representing pilots and air traffic controllers were also involved in this. And I can't think of a more efficient arc that I've been involved with in quite some time to address such an important issue.
The committee has had a series of meetings since it was formed in December 2023 to come up with recommendations to address the FAA's handling of mental health diagnoses and the stigmas that keep pilots from reporting and seeking mental health care. They also want to increase the mental health education for aviation healthcare professionals.
I think overarching and broadly, the ARC came up with some recommendations, mainly centered around education for pilots, for controllers, for physicians, in dealing with mental health issues, ways to improve the process so that pilots that do come forward, they understand the different pathways that can ultimately be taken with if they have an episodic mental health issue or a more severe mental health condition, that they know the process is essentially what will happen when they self-report or when they come forward, or do they even have to come forward? Those kinds of things I think we really wanted to really drive home. And then moreover, the processes that the FAA has in place now, the system, clearly needs to be modernized. It needs to be made more efficient. And we have to ensure that the FAA has the resources available to them to address these issues. So I think broadly, those were kind of the conceptual ideas that the committee addressed.
The committee identified several factors that play into why a pilot may choose not to seek treatment or disclose their symptoms with their AME. Those challenges were broken down into 7 categories: the culture within the aviation industry, a lack of trust in the FAA, AMEs, and the whole aeromedical process, fear of the potential loss of medical certification, mental health stigma, financial concerns, the complicated medical certification process, and a mental health information gap on the part of the pilot, controller, or medical professional.
Well, certainly the Advisory Rulemaking Committee was established to address mental health barriers with pilots and air traffic controllers, to break down those barriers, quite frankly, and help educate pilots and physicians and AMEs on processes and those kinds of things, to really try to make our aviation system as safe as it can be. So that was really the overarching goal, was to break down those barriers that prevent pilots and air traffic controllers from coming forward and that might have issues with mental health issues of varying degrees.
The report outlines 24 recommendations for the FAA for their handling of mental health cases. A few of the key recommendations are to revise and evaluate the requirements for disclosing mental health therapy and various mental health conditions, a non-punitive pathway for disclosing previously undisclosed mental health conditions and treatments, ensuring that screening protocols and requirements are based on safety management system principles and are appropriately communicated to applicants, encouraging the expansion and use of peer support programs, developing a re-education campaign to increase mental health literacy, education, and awareness, increase mental health training for AMEs, and modernizing the FAA's information and medical certification systems. A recommendation related to medication mentioned revising the requirements for pilots on a single approved antidepressant for the treatment of uncomplicated depression or uncomplicated anxiety, and suggests evaluating the possibility of allowing pilots diagnosed with ADHD to use medication while on duty. In the report, the committee said the recommendations are interdependent and all need to be implemented to fully overcome the barriers, and that implementing the recommendations associated with these barriers will set the stage for a seismic shift in how the industry perceives and manages the risks associated with mental health conditions. This shift in perception will take time and will only occur after the recommendations have been implemented, allowed to gain traction, and embraced by pilots and controllers.
Well, now the FAA will review the recommendations. They will hopefully work, and we want to work with them to implement the recommendations. They're not required to implement them, but we're certainly hopeful that they will. I know they have every intent to implement the recommendations, so we look forward to working with them as we go forward on that. And I can't say enough about the FAA actually even taking on this issue. I think it's past time, and these recommendations I think are a really good first step in moving forward to ensuring that those with mental health issues do come forward, and we can break down those barriers so that they will do that. And I think the leadership of the FAA medical division, in particular Susan Northrup, the federal air surgeon, has just been outstanding. So this is going to be a really good effort going forward, and we look forward to helping the FAA implement these recommendations.
You can read the full report and all the recommendations at the link in the description below, and we'll continue to report on this topic as progress is made.